Psychosocial strategies for athletic training. The goals for this course are to recognize the role of the stress and other psychosocial antecedents to injury. We need to identify the psychosocial aspects of athletic injury and what athletes expect from their healthcare providers. By identifying typical post-injury emotions and the role that the athletic trainer can play, we can help to facilitate a positive coping response in our patients. We need to be able to describe the important role of communication throughout the injury process, from the initial injury and throughout the rehabilitation and recovery and even return to play. We should also be able to explain the importance of educating injured athletes on interpreting the meaning of pain and its implications for training and rehabilitation. Additional goals are to recognize the role of the athletic trainer, both as a source of social support for injured athletes and as a facilitator to identify other sources of social support in the athlete's life. We should be able to describe the integration of the psychosocial approach to injury recovery and identify useful tools for the athletic trainer to implement with the athlete, including positive self-talk, motivation, and pain management strategies. These can all increase our patients' overall outcomes and their adherence to their rehabilitation protocol. We should be able to identify the basic elements of the response to sports injuries and how athletic trainers can play a role in athlete recovery and referral. The psychosocial role of the athletic trainer is outlined by many of our professional organizations, including the CATIE, or Commission on Accreditation of Athletic Training Education Standards and Procedures for Accreditation of Professional Programs in Athletic Training, and by the Board of Certification in both the Role Delineation Study and the Practice Analysis. The Role Delineation Study and the Practice Analysis are both utilized to create the National Certification Exam and also by many state organizations to determine what roles an athletic trainer can do and what is considered within our scope of practice. Additionally, the National Athletic Trainers Association, or NATA, has multiple position and consensus statements that we will explore. Let's first explore the Role Delineation Study. The Role Delineation Study is a survey of certified athletic trainers and other stakeholders in the athletic training community. The survey is conducted periodically and asks questions about the tasks and responsibilities of an athletic trainer, as well as the knowledge and the skills that are needed to perform those tasks effectively. This study is an essential tool to evaluate the knowledge and skills needed to practice as a certified athletic trainer. In the Role Delineation Study, we can see the domains. These 5 domains match up to the 5 practice areas that are seen on the Board of Certification National Exam. Domain 1 includes injury and illness prevention and wellness promotion. This includes tasks like identifying risk factors by administering assessments, pre-participation examinations, and other screening instruments, and reviewing individual and group histories and injury surveillance data. Another task within this domain is optimizing wellness. This includes social, emotional, spiritual, environmental, occupational, intellectual, and physical wellness for individuals and groups. We can see Domain 2 has tasks under examination, assessment, and diagnosis. Additionally, Domain 3 has some tasks that are associated to the psychosocial intervention and strategies for athletic trainers. This includes caring for immediate and emergency care injuries. Domain 4 focuses on therapeutic intervention. And Domain 5 is healthcare administration and professional responsibility. So what is the importance of psychosocial aspects of injury? It is important to remember that injuries are not just a physical assault on the body. Injuries are both physical and mental in nature. Personal and situational factors influence injury and recovery from injury for an individual. The response to injury process is different from person to person. Stress is a major factor in injury risk and rehabilitation success. Additionally, exercise adherence has a lot to do with stress as well. By identifying the role of the athletic trainer in managing psychosocial aspects of injury and recovery, we can help our patients lead better quality lives. Some personal and situational factors. This is known as the psychosocial approach. Some personal or individual factors that may influence an individual include their injury history, injury severity and type, injury cause, recovery status, personality, self-motivation and self-esteem, motivation orientation, athletic identity, pain tolerance, coping skills, psychological skills, mood states, gender, age, and ethnicity, prior sports experience, social economic status, and physical and nutritional health. Some environmental or situational factors include sport type, level of competition, time and season, scholarship status, playing status, coach and teammate influences, family dynamics, athletic trainer influences, social support networks, sport ethics, rehabilitation environment, and accessibility of services. We will dive deeper into many of these topics as we move through this course. But please understand that all of these are important to understand how an individual will respond to our care and treatment of their athletic injuries or sports-related injuries. Some psychosocial factors associated with the outcomes of sports injury rehabilitation in competitive athletes. Psychosocial factors include how an athlete thinks, feels, and acts that are associated with the outcomes of rehabilitation. The athlete's psychological readiness to return to play appears to be a product of fear, anxiety, and sometimes confidence in performing well and remaining uninjured. Being female, young, having a limited experience of injury, negative emotions, and perceptions of isolation are all factors that are related to less successful outcomes in rehabilitation. Additionally, our current interpretation of a successful rehabilitation is overly simplistic. In most cases, return to play is our end goal. While the rehabilitation process is associated with many biopsychosocial, technical, and tactical factors that must be all considered when we treat our patients in a holistic manner. Practitioners need to be aware that injured athletes are emotionally vulnerable and that their emotional integrity may be questionable during the rehabilitation process. Practitioners should encourage athletes to perceive the injury experience as an opportunity for growth and development. A positive mindset can have a very positive influence on their rehabilitation and recovery. Additionally, practitioners need to ensure injured athletes are physically, psychologically, socially, tactically, and technically ready to return to sport. And practitioners should not assume that physical and psychosocial recovery from injury occurs within the same time frame. Ultimately, as an athletic trainer, we are our athletes' best advocates. We need to protect the health and welfare of our athletes. That's our job. It may be also important to look at some of the predictors of injuries in team sports. Personality traits such as high trait anxiety. We'll delve into this more in the semester. A history of life stressors, such as high life stress or previous injury, and poor coping resources, such as low social support, have all been linked with increased injury risk. These personality, history of stressors, and coping resources all invoke a stress response. This includes a cognitive appraisal and a physiological attentional change. Debilitating attentional or distracting peripheral narrowing and physiological changes, which include muscle tension, fatigue, reduced timing, and coordination, are all proposed to occur when an athlete appraises the athletic situation as threatening. We can help our athletes then with some interventions. Cognitive behavioral interventions focus on stress management and relaxation techniques that have demonstrated a large effect on reducing the number of injuries among athletes. What are psychosocial aspects and how do they play into the injury prevention? Stressors include things like schoolwork, social life, relationships, and even athletic success. This can also include environmental stressors. We can help our athletes or patients by developing skills to help manage this stress load. We can employ some techniques such as leaving your bag or your bag of stress at the door when they're coming in for rehabilitation. We can focus on practice at practice, and we can also encourage good sleep and good nutritional habits. The emotional response and coping with injury. Athletes' responses to injuries vary greatly. Cognitive appraisal models attempt to explain the differences in the responses. Influential factors may include the history of injury, time in the season, and the current stress level of the individual. Environmental and situational factors that influence the response to injury may include sport, social, and environmental factors. The sport includes the type, level, and scholarship status of the individual. The social factors include the coach, teammate, and family influence dynamics. And the environmental factors include the rehabilitative environment and even the accessibility to rehabilitation. This may have a huge implication for athletic trainers. Our availability does matter, but this bumps into problems with work-life balance sometimes. So these are important things to help manage burnout in athletic trainers. Personal factors that influence the rehabilitation and recovery process. Injuries and individual differences. An individual's injury history, the severity of injuries, the type of injuries, and the perceived cause may all have an effect. There are individual differences in psychological, demographic, and physical responses. Psychological differences may include personality, motivation, or mood states, as well as many other things. Demographics can include things like gender, age, ethnicity, social economic status, and prior sport experience. We also need to examine the athlete's expectation of their healthcare provider. We will explore some best practices related to the psychosocial strategies that athletic trainers should use and what's proven effective. We also need to look at what athletes expect from athletic trainers. Research has determined that athletes will expect a different response based on the athletic trainer's gender. There may be also differences based on prior experience with athletic trainers, whether they had a good experience or a poor experience, and also differences based on injury history. Their response may be elevated if this is the first time they are injured. Also, the atmosphere and social support. There are gender differences commonly in social support following injury, and gender-based needs following the injury process. So how do we leverage the role of psychosocial strategies and the referral process to facilitate recovery from athletic injury? What are athletic trainers educationally prepared to offer? What evidence exists to suggest that strategies work in pre-injury and recovery situations? There are some theoretical explanations of how strategies work, but you may also learn from a lot of on-the-job or clinical training in this area. It is important to know what our limitations are in our scope of practice as well. There are some things that athletic trainers are just not prepared to deal with, so knowing when we need to refer these situations to additional resources is vitally important. Among the various topics that we'll explore are some of the psychosocial strategies on this slide, including goal setting, self-talk, relaxation, non-pharmacological pain management techniques, the underlying factors for motivation, and patient education importance. So some food for thought. You don't have to respond to this. This is not an assignment. But as you're thinking about the things that we just talked about, let's take a look at Seth as our athlete insider example. Let's see if we can determine some effective psychosocial strategies that the athletic trainer could use with Seth. Seth is a freshman Division I football athlete. He's beginning to have self-doubt that his skills are at the collegiate level. He had high success in high school, but seems to be struggling at the collegiate level. He's experiencing a lot of pressure from family to help support them with the name, image, and likeness deal by bringing money into the family household. Unfortunately, Seth was injured in practice in an awkward tackle, and he is now concerned about his scholarship status. By pairing stressors with strategies, what could an athletic trainer provide to Seth to be effective in his or her role as a healthcare provider? Where would you even start? This is a real-life situation that you could be exposed to, so start thinking about these strategies as we move through this course. The take-home points that I want you to remember from this lecture. Holistic care of an injured athlete is the current focus of much of the medical literature out there. Athletic trainers are educated in selection and the application of psychosocial strategies, and you need to know your limitations and refer our patients when it goes beyond your training. As healthcare providers, athletic trainers make a huge difference in decreasing an athlete's injury risk and improving the overall recovery process. Our job is important, and what you do matters. You will have the opportunity to influence many individuals' lives as your role as an athletic trainer.